Thanks everyone for being here this morning. So we're seeing across the world more cases of monkeypox and in Connecticut as well. And one of the important lessons of many that I think came from coronavirus and COVID-19 was the importance of being very proactive at sharing information with the public on an ongoing and repetitive basis, because us all having as much knowledge as possible to understand these viruses, to understand how they're transmitted, to understand what the symptoms are, and to understand how to prevent them is so important to our ability to prevent the spread of the virus. And so we're gathered today with our health partners in New Haven from Yale New Haven Health, from Fairhaven and Cornell Scott Federally Qualified Health Centers to help educate people on the symptoms, treatment, and give an update on the situation in New Haven and Connecticut, but most importantly to give people the tools to help prevent the spread of the virus. So far in Connecticut, we've seen 13 cases total. There's been 2 cases in New Haven, and the 2 cases in New Haven are both males, one in their 20s and one in their 30s. We are working closely with our state partners at the Department of Public Health as well. Director Bond's frequently on group calls with them, with other health directors and other municipalities as well, to closely monitor the spread of the virus. Monkeypox is, as many people know, very, very different than COVID-19, and its transmission is preventable. We're going to hear from the health director and from our health partners about how people can do so and how they can get treatment. One of the things I think that you will hear over and over again is if you have symptoms, seek out treatment. From your provider, if you have your own medical provider, but every one of the 3 providers here is open to receiving new patients. If you need information or think you have symptoms, you can also call the New Haven Health Department main line and they will connect you with resources. That phone number is 203-946-6999. It's 203-946-6999. And the New Haven Health Department has a dedicated webpage that has a lot of information on monkeypox as well. I'm going to hand it over to Director Bond to go into some more details here.
Thank you. Thank you and good morning. So as the mayor mentioned, the health department is actively conducting surveillance and monitoring of this emerging disease. It is important for us to really continue our messaging around monkeypox. We have seen the news and monitoring this both internationally and nationally across the United States. Monkeypox, as you know, is from the same family as smallpox, but it's a milder and also not related to chickenpox. So we want to make sure that individuals understand that the strain is circulating in the U.S., but it's rarely fatal. But other strains have resulted in severe complications and death around the country. Internationally, not in this country. Symptoms of monkeypox, of what we have been seeing actively with our monitoring locally, has been predominantly fatigue and also blisters or lesions in the genital areas. However, other symptoms can include fever, headache, muscle aches, backache, swollen lymph nodes or glands, chills, as well as a rash. And so we want to make sure that it can also be mistaken and make it noted that it could be mistaken as an STI, a sexually transmitted disease. And so it's important for individuals that are presenting any of these symptoms to get access to testing, including for monkeypox, to determine any diagnosis. Our situational awareness currently, as the mayor mentioned, as of today, we have seen across the country over 14,000 cases within 70 countries internationally of cases being reported. We also have seen throughout the United States that we have seen over 2,000 cases that have now been reported. And their age range is between 32 to 43. The median age range is 37. However, within the state of Connecticut, we are seeing an age range as far as early as 20, young as 20 and 60 years old. And so how does it spread? It really does spread through direct skin-to-skin contact with a rash, sores, or scabs from person with monkeypox, including during sexual activity. It can also spread through respiratory droplets, possibly through short ranges of that, and can also spread through fabric or other objects like clothing, bedding, or towels, or surfaces touched by someone that has monkeypox. Typically, the incubation period is 3 to 21 days following an exposure. And so what our role is at the health department is to monitor any close contacts of anyone that has monkeypox through that duration of incubation period to ensure that we are staying connected with the community and monitoring for any symptoms that may arise so that we can provide guidance and support. We want to make sure that we are using preventive measures, and these preventive measures include avoiding close-to-close contact with individuals who may have any type of sore or rash. We want to make sure that individuals that are diagnosed with monkeypox really isolate and avoid close contact with individuals within your own household, making sure that if you're sharing a bathroom, that you're also making sure that you're cleaning and disinfecting as well, and maintaining safe distance between those in your household, and this includes any animals that may reside in your home. We ask that you wash your hands often with soap and water and use alcohol-based hand sanitizers. And so we want to make sure that if you present with any symptoms, that you call your healthcare provider immediately to ensure that you request testing, isolate, meaning that you should not go out in public places during your symptomatic period, and make sure that you seek access to healthcare. If you do not have a healthcare provider, we will talk a little bit about how to access healthcare services within our 2 federally qualified health centers, who will be speaking momentarily. Testing is readily available and free through the state laboratory here in Connecticut, as well as a little bit about vaccines have been a common question nationally as well as locally and statewide. And so vaccines, as you know, are limited in supply and are really accessible for individual who has been deemed high risk exposure or intermediate exposure within a grace period of 4 days. And so we want to make sure that individuals who come close contact with someone that has been diagnosed with monkeypox then will be in contact with the DPH or local health department in conjunction with the healthcare provider that you see. And what we want to do is actively inform the public and inform you that we are working closely with you as a community. We are here for you to provide information in multiple languages, so we want to make sure that you visit our website, as the mayor mentioned. You can give us a call at the health department to get any questions answered, or your local health department. We also want to make sure that you have access to materials, and so please visit the website to get access to the materials that have been created for you, and also call your healthcare provider again if you are presenting symptoms, because we want to try to ensure that we're working as a community to prevent this emerging disease to impact our community any further. And with that, I'm going to turn it over to Dr. Dalal, who's going to talk a little bit about the Community Service Administrative Initiative.
Thank you, Mayor, and thank you, Director Bond. As the Community Services Administrator overseeing the Health and Human Services agencies, I see a common pattern with some of these conditions, which is stigma, shame, and silence sometimes are the primary barrier to seeking out care and treatment. And from the perspective of the city, and I know our healthcare partners will speak shortly, it's very important that if you do have symptoms and you do feel like you might have an exposure, to come forward and seek care. To be blunt, a lot of these folks, we still live in a time and with communities where there's shame associated with the behavior. For men who have sex with men, people who have multiple sex partners, it is important to not stigmatize the behavior from a public health perspective, because these people need care, and from a public health side, we need to identify them so we can stop further spread. So, from the community service side, I think we aspire to offer care without judgment, the highest level of privacy, and then it's important to go to a trusted individual, trusted provider to come forward. And I know our healthcare partners will speak a little bit more about that. Thank you.
Thanks, Dr. Jalal. So just before I hand it over to a first speaker on the healthcare provider side, Dr. Martinello from Yale New Haven Health, wanted to express my gratitude to our partners. Throughout COVID-19, we have had such a close and developing relationship and relied on each other, and very, very grateful for not only their partnership, but the fact that and I think we can be quite proud of this in New Haven, all of us work very hard to ensure there are zero barriers to access to healthcare in New Haven, and I know that that reflects on the values of our city. And I'm very proud that we have these three entities that work very hard to do so in New Haven. So I'm going to hand over to Dr. Martinello, Medical Director, Infection Prevention from Yale New Haven Hospital. Yale New Haven Health.
Okay, thank you very much, Mayor Elker. So thank you for having this conference today and inviting us to speak about this very important topic. Our office, our healthcare system, and Yale Medicine has been working very hard, really on a daily basis, coordinating with Director Bond's office, with the State Department of Public Health, and with many of our local public health entities to make sure that everybody is aware of the problem that's going on, how to prevent it, and for those who have symptoms, making sure that they have access to treatment and to vaccination if it is indicated. We've been doing an enormous amount of work internally within Yale Medicine and within Yale New Haven Health to make sure that we can provide the access necessary to our patients and to our community. And this has involved making sure that our pharmacy has medications that are available for those who have severe disease and require treatment, making sure that we have vaccine available for those who need it as post-exposure prophylaxis, which right now, thankfully, is a very small number of individuals, and making sure that we can reach out to the community so they're aware that access and treatment and care is available for everybody who needs it. We do have a call center that is available for questions. We're actually receiving on this call center about 2,000 calls a day. Right now, few of them are for monkeypox specifically, only about 1%. But this call center is available for anybody who may have questions about monkeypox, or especially if they have concerns about their own health or health of a family member. The number for that call center is 1-877-ASK-YNHH. If anybody needs an appointment, even if they don't have a doctor, we have appointments available also through 1-833-ASK-YNHH, and also through Yale Medicine at 1-877-YALE MDs. And so those appointments are available. And, finally, I'd just like to close again, thanking everybody for bringing us together today to talk about this most important situation. We do expect that we're going to continue to see more cases of monkeypox in our community, but I expect that with our outstanding public health partners, we'll be able to manage the situation just as we've managed COVID. Thank you.
Thanks, Dr. Martinello. Now I'll hand it over to Dr. Mon from Cornell Scott.
Thank you, Mayor. Thank you, everyone. I'm very happy to be here, and I'm glad that awareness of this issue is being raised. I just wanted to let everyone know that we do want to echo the voice that anyone that has had an exposure or worried that they had an exposure or having any symptoms to really seek care with their provider. All of our locations, our Cornell Scott Hill Health locations, are open for new patients as well as established patients. We encourage anyone to call our main number at 203-503-3000 to set up an appointment. Alternatively, patients can also walk into our location at 428 Columbus Avenue, which has our convenient care site and is happy to take walk-ins. All of our sites are able to do testing for anyone that's concerned, and we would link patients that were deemed eligible for vaccines or treatment to the appropriate locations. Thank you.
And finally, nurse practitioner Jennifer Susky from Fairhaven.
Good morning, and thank you for having me. As a healthcare provider, I understand that news about this may feel overwhelming, but I'm glad to be here with you today. I want to give New Haven residents some guidance on what to look for and expect, and some reassurance that we are here if you need it. We encourage anyone, as you've been hearing, with any concern about symptoms or possible exposure to reach out to their primary care as soon as possible. If you see anything from a little bump to an open sore, especially in the mouth, genital, or anal area, that is another reason to reach out to your primary care provider. At Fairhaven Community Healthcare, we've been testing patients as needed and plan to continue doing so. Getting tested is simple. When a patient calls with concerning symptoms, we get them in and swab the lesions. The swabs are sent off through the lab, and patients are advised to isolate until they get their results. Once the results are in, we notify the patient right away and go from there. If New Haven residents don't have a primary care provider, we are happy to see them. We have care in languages other than English available as well. And as always, Fairhaven Community Healthcare is ready to respond as necessary based on the needs of our patients and our community, should we see a rise in cases and as other resources become available. Anyone, regardless of ability to pay, is welcome to our culturally sensitive care by calling Fairhaven Community Health at 203-777-7411 to make an appointment, and new patients are welcome. Thank you.
So before we open up to questions, just want to underscore, if you have symptoms, call your healthcare provider. And also what Dr. Dalal said is quite important. So anyone can get monkeypox. And we have seen more individuals that have gotten monkeypox so far that are men who have sex with men. However, it is very important to underscore that anyone can get monkeypox. We need to make sure that all people take action to prevent the possibility of contracting monkeypox, and we all do our part. And if you have symptoms, contact someone. Questions from folks?
Are men who have sex with men the group at the highest risk of exposure to monkeypox? Or are there other groups that you want to make sure to identify as very high risk or high risk for monkeypox?
So yes, at this time, men having sex with men are the highest risk at this juncture, but as we mentioned, this can impact anyone, but closely monitoring the different groups, and at this juncture it is.
Do you recommend that people who are at high risk of exposure but who do not have symptoms seek out vaccination, or are you only recommending if someone has symptoms that they seek out vaccination?
So the vaccine is available for anyone that has been deemed exposed and has been classified as high risk or intermediate risk of someone that has monkeypox.
So you don't need to have symptoms in order to seek
Once
out
you have monkeypox, a vaccine is not, you're not eligible to get the vaccine.
And then just to be clear, the health department and the health organizations here, you all have supplies of vaccines, like people can get vaccines?
We do not.
So the health department does not have vaccines? Does Yale need help from Fairhaven?
Well, yeah.
Yeah, through the state of Connecticut, some of our hospitals do have a small amount of vaccine that's available. And as Director Bond had said, that vaccine is specifically available for people who have had significant exposures to monkeypox. The state of Connecticut is working hard to acquire more vaccine to make sure that we have it available for everybody who has an indication for vaccination.
And then 2 people in New Haven who have tested positive so far, are they in the hospital? Can you speak a bit of how they're doing, what their condition is, how serious it is?
So at the local level, what our responsibility is to do contact tracing. As you know, that means that we track individuals that are diagnosed with monkeypox as well as any exposures. The cases were both mild, and so they are recovering and doing well and not in the hospital.
Okay. Anything else? All right. Thanks, everybody.
Thank you.